privilege to address you today. The Canadian Epilepsy Alliance currently has 24 member agencies that represent all of the provinces. This number is down by 4, as 4 agencies could not survive through COVID and had to close their doors. The CEA membership is comprised of the epilepsy community agencies across the country, and it provides counsel and support of people living with epilepsy, their families and caregivers. We are the direct link to people living with epilepsies, and these agencies form a vital component of their comprehensive epilepsy care. The CEA is the official community partner for the Canadian League Against Epilepsy and a full voting member representing Canada in the International Bureau of Epilepsy, where our past president, Deirdre Floyd, is the sitting member. This entitles the CEA to also represent Canada as part of the North American Commission of the IBE, where Deirdre is vice president. The CEA are members of Neurological Health Charities Canada and Best Medicines Coalition. Currently, we've collaborated with the American Epilepsy Society and the Epilepsy Foundation, along with other international organizations, to put resources together in English, French, and Spanish in recognition of Suit Up Action Day, which is on October 19th, but this year it will be the whole month of October. We've together created a toolkit that can be downloaded from the CEA website as of tomorrow. And there's a one-page back and front of really valuable information, as I know it's difficult to address this topic, and we're quite proud of it. Also in the toolkit, there's some videos that our agencies have contributed, including some webinars from some doctors in this room. And the CEA has, we've contributed to these videos and webinars, and we're quite proud, and they'll be distributed throughout North America. With the devastating effects of COVID-19, lockdowns, requests for services greatly increased. As the already isolated population we serve were and still are further isolated. The impacts of the pandemic negatively affected people with epilepsy in so many ways that the community agencies quickly moved all support to virtual platforms, allowing individuals to access our support, be on group calls for not only counseling but also social interactions. Some agencies held game nights just for this very reason. Many CEA agencies furthered their outreach by providing interactive professional webinars on various medical topics of concern, which many of you participated in, which we are so grateful for. These webinars were open to the whole country and are still available on some of our websites. The impact of COVID greatly threatened the financial well-being of every community agency in Canada. The sudden cancellation of all of our fundraising events was devastating, and many are struggling still today to come back from that. I want to talk about the non-medical burden of epilepsy. In writing this and consulting some of my colleagues, I'm really referring to our work as non-clinical care, mental health disease management, and reducing emergency room usage. We participate in most of the studies brought forward by all of you in this medical community who ask for either input or through your studies we send to our client memberships and sources. What we do is health, a continuation of health. We are partners in healthcare delivery, not in the clinical setting, but in the community setting. There are written provincial guidelines for management of epilepsy care in Ontario, for example. The community epilepsy agencies are stated and shown in flow charts to be an intricate part of the comprehensive care of epilepsy patients, and yet there's no funding. We provide a community-based setting with community-based focus. Continuity of care starts in the clinics and continues into our communities. The difference is economics. There's money for medical care and there's no money for non-medical care. Please think about all your patients who go to the ER unnecessarily, who call our office with feelings of anxiety and depression and need to talk. And they call your office too. Increased PNES diagnosis was evident as well. And it takes approximately 1.5 years to see a neuropsych for the first appointment. Therefore, we, the community agencies, are that stopgap. And we do support patients in this way. We need neurologists and epileptologists to advocate on our behalf. Province by province, we need your support. By supporting us, we free up your time and you can see more patients. We provide the ongoing education to these patients. We are actively able to provide qualified mental health with ample funding. 5 years from now, our agencies could all be gone. So I'm asking the medical community to please help us maintain and sustain our work. All while accomplishing this work, we are simultaneously in the event business. But all we want to do is epilepsy care. Fundraising events and activities are the only way to fund the core costs of epilepsy.